legacy of the Ketterings is so important. People, when they hear the name Kettering Medical Center or Kettering Health Network, they feel that it's Kettering because it's in the city of Kettering. And people don't even know anymore why the city of Kettering is named Kettering.
My great-grandfather was Charles Kettering I, and he was married to Olive. Their son Eugene, he married Virginia, and then they had my father, Charles II, and his second sister was Jane, and then the youngest was Susan. So I'm the second Susan. I've gone up to pay for something, and someone goes, "Oh, how cool! Your parents named you after the city." I was like, no.
Kettering Memorial Hospital owes its name and its innovative spirit to Charles F. Kettering. The self-described screwdriver and pliers scientist possessed a tenacious, practical, problem-solving nature that changed the 20th century. In his early career, he worked for the National Cash Register Company in Dayton, Ohio. Here, he quickly distinguished himself by electrifying the cash register. During his off hours, Kettering and several fellow NCR employees, including his eventual lifelong friend, Colonel Edward Deeds, began working in Deeds' barn to tackle challenges related to automobiles. They called themselves the Barn Gang, and when they developed a better automobile ignition and lighting system, they quickly formed the Delco Corporation. Soon after that, Kettering achieved his next most famous invention, the automobile self-starter, which removed the hand crank from the front of cars and made them safer and more practical for the general public. Delco became part of General Motors, and Kettering became the vice president of research there, a position he held for the next 27 years. While the self-starter is his most famous accomplishment, Kettering's 186 patents included anti-knock gasoline, fast-drying automobile paint, an incubator for premature infants, and Freon. His home, Ridgely Terrace, was the first house in the United States to have central air conditioning. His wisdom soon became as sought after as his inventions.
Early in our days, we were made very aware of the uniqueness of Charles F. Kettering by listening to the radio. On Sunday night, he had a special program for an hour. And I don't know how I first happened to listen, but I was hooked from the first one.
That if Thomas A. Edison, the Wright brothers, and Henry Ford had taken IQ tests, they wouldn't have gotten in the bleachers. Now, why? Not because they were stupid, because IQ tests have nothing to do with the fellow that's being tested. And it's amazing what some of those people that you throw out do.
At the time of Charles Kettering's death at the age of 82, he held the distinction of being second only to Thomas Edison in the number of U.S. patents held. But he was also distinguished by his intense commitment to his community.
He did his work here. He was with Colonel Deeds and the Wright brothers. I mean, this is where it started. There was always this belief of giving back to the community that had supported you.
During the polio epidemic in the 1950s, Charles Kettering's son Eugene and his wife Virginia were living out the Kettering commitment to caring for their community.
Where the Ketterings came in connection with Adventist Healthcare was in Chicago, and Virginia was doing some volunteering at Hinsdale Adventist Hospital.
And she watched firsthand how that hospital took care of the polio victims who came into that hospital. And both she and her husband, Eugene, were impressed with the incredible compassion and care with which that healthcare was delivered.
And Eugene and Virginia were so impressed with the care at that hospital that they invested $1 million into providing care for polio through the iron lung machines.
The Ketterings' experiences with Adventist healthcare weren't limited to the Chicago area.
The story came to me through Mr. Kettering in his visits around the world that he used to do for 2 to 3 months at a time. He would encounter 3 things: Coca-Cola, Singer sewing machines, and Seventh-day Adventist medical mission work, either a clinic or a hospital.
Adventist Healthcare was established almost when the denomination was established. It came out of the early care, a desire to make man whole.
In his later years, Charles Kettering became more and more interested in medical research. So when he passed away in 1958, his family decided to memorialize him by building a hospital, a living memorial, on the family estate in Kettering, Ohio.
Eugene Kettering and his wife, Virginia, went to the city council and they said, we want to give Kettering a hospital. And that's when the council said, who's going to run it? And Mr. Kettering said, well, the Seventh-day Adventists know how to run hospitals.
The then CEO of NCR sent out a cablegram to all of his sales managers and asked 2 questions. Is there an Adventist hospital in your community, and is it a good hospital? What reputation? And those that said, yes, there's one, came back and always said, it is an excellent facility. So they agreed to go and visit Hinsdale. They went and visited Hinsdale and came back and embraced the Kettering's request that this be an institution of very high standards, quality, technology, and spiritual care.
An experienced hospital administrator named George Nelson was selected by the headquarters of the Seventh-day Adventist Church to head up the project. Mr. Nelson's inaugural trip to Dayton was something of a shock for the longtime Californian.
It was November 1959. I was tired. It was freezing cold. Rain was spattering on the windows of the yellow cab. Why did I let myself get caught up in this, I thought, as I signed the register in the old Biltmore Hotel. Morning came. The phone rang. This was Mr. Kettering's attorney. What are you going to do with the money? What money? I asked. The money in the Winters Bank. I've never been in the Winters Bank. Doesn't matter, he said. There's an account there in your name. It has a credit of $1 million. What an expression of confidence. I had not met Mr. Kettering. He only knew that I had been selected to lead out in developing the proposed Kettering Memorial Hospital, which later became the Kettering Medical Center.
When Mr. Nelson came, I know that the story goes that Mr. Kettering said, George, I've got the plans drawn up for the hospital.
The architects had been employed a year before I arrived and had prepared the plans, had the layout completed. They handed me the plans and asked me to okay them. I found them to be quite unacceptable insofar as the general organization of the hospital is concerned.
How is George going to go back to the benefactor and say it's all wrong? But he did, because to get off in the wrong direction is to end up at the wrong destination. And George reset that dial right then.
We spent a year making changes. A few of the major changes we made were provide 3 nurses' stations on each floor. They had planned for 1 nurses' station to serve all 3 elements. It was located in the lobby in front of the elevators. And there are many other changes that we made, thousands of details that had to be decided.
And that's been legacy to Kettering, to do things intentionally, to do them right at the first, and then to make sure that we care for the people in the midst of them as we go forward.
Once the plans were properly in place, a groundbreaking ceremony was held on July 7, 1961. More than 1,000 people were in attendance, among them Dr. Vernon Luthus.
It was a tremendous feeling that a great philanthropist, Mr. Kettering, was going to build a hospital, giving it to Seventh-day Adventists to run and operate.
Soon, construction began, and Mr. Nelson and his team had a new, very daunting item on the to-do list: recruiting physicians and staff.
We tried hard to make friends with everybody in the community. We promised the local hospitals that we would not advertise locally so that we would not disrupt their services. We traveled the country and recruited people. And I think we're unusually successful in putting together an original staff. And we were all new employees. And there was a great feeling of fellowship, and we all worked together in a great adventure.
When we came, we went to the bank up here at Town and Country to get a home loan, and we sat down, my wife and myself, with a builder, and they said, well, now, what is your salary going to be? And I said, you know, I don't know. I didn't even ask.
As construction on the interior of the hospital continued, there was one more addition to be made.
As the hospital neared completion, the Harrison family offered to provide funds to assist with the addition of another floor. Mr. and Mrs. Kettering promptly agreed to provide the difference, and a fifth floor was added to raise the capacity from 300 beds to 400 beds.
The completed hospital was more than just new, it was innovative to the finest detail.
If you take a look back at 1964 and you walked into the hospital as it was then, it was way before its time.
When we came in, when we first saw the hospital, at the lobby, we said, this is not a hospital, this is just like a hotel, first-class hotel. So that wherever we went, we said, well, we work at the Kettering Hilton.
One of the original things we did was to redesign a patient's room. Hospitals generally in those days had a little closet inside the door, so that if a patient needed a robe or a gown, he'd have to run over to the door in his shorty and get what he wanted, and he'd go back to bed. So we created a design with a closet, running water, controls for all the electric and electronic gadgets in the room, right at the bedside. It was quite an innovation.
On February 16, 1964, the hospital was dedicated in anticipation of receiving its first patient on March 3rd.
On the day of the dedication, Mr. Kettering had invited over 200 of his friends from all over the world, and Dr. Annis, president of the AMA, was a keynote speaker. And Dr. Annis said, if you are so lucky to have Seventh-day Adventists run your hospital, you have made a right choice, because they run the best hospitals in the world. Mr. Kettering, he said, I felt 10 feet tall, at that time, because he just felt vindicated that the community would know that he had made a right choice in inviting Seventh-day Adventists to run his hospital.
With everything in place, the doors were opened for the first patient.
I was involved with the opening up of Kettering, and it was slow to begin with, because that was sort of strange to have a hospital with many, many beds and not full.
Remember that on day one, we admitted one patient, and then later in the afternoon, 3 or 4 more. But at that point, we had 500 employees. And when the door was opened for patient number 1, everything in the hospital had to be ready to go. When the patient number 1 was discharged, then you send a bill to Blue Cross or some insurance company. 30, 60, or 90 days, when they get around to it, they send you part payment, and then you bill the patient. Eventually, you get some money flowing. That was difficult, but we met every payroll.
I often said about Kettering, you could never get bored, because it was always moving on towards something more, something more.
I really enjoyed working here. I couldn't wait to get to work in the morning so that I could be part of this great organization that was starting.
We had one surgery the first day, one bronchoscopy. You had to get your staff oriented and in place, and then it started to grow pretty rapidly.
The medical staff was led by its first chief of staff, Dr. Robert Taylor. This was a volunteer position with no support staff, and the composition of the hospital's medical staff was very different than it is today.
One of the characteristics of medical care at that time was that essentially all hospital patients were cared for by their primary care or family physicians who would follow them to the hospital and render care.
In my family practice, we were really busy. We delivered our own babies. We didn't send them off to an OB/GYN. We did it ourselves. My practice alone was something like 13,000. It was a lot of babies. And I made house calls too.
Kettering Memorial Hospital's plan to create and operate its own college faced a challenge very early on.
When we first went to the North Central Accrediting Association to show them our plan and ask if it would qualify for accreditation, they said no, because hospitals do not run colleges. Colleges run hospitals. So we came home and wondered what to do. We were dejected but not discouraged. We changed the name of the corporation from Kettering Hospital to Kettering Medical Center. The Kettering Medical Center would then run the Kettering Hospital and the Kettering College. That was acceptable.
In 1967, the Kettering College of Medical Arts welcomed its first class.
I was very struck by the whole sense of family and the excitement of a new place. Clearly everybody was excited about starting the college. And people had come from all over the world.
Those first beginning faculties, none of them said, my job description is thus and so. You just did what needed to be done, and everybody just worked hard at it, and it was a kind of an atmosphere I just thrived on.
As we were working feverishly to get the hospital open, the housekeeper had made the comment to me. She says, well, I'd like to know who Mrs. Kettering is. And I says, well, right over there is Mrs. Kettering. She looked over there and she said, I didn't know that was her. People say, oh my, this is a Kettering family, and they're ready to jump. But they were just as practical as anybody that you would ever want to meet.
Mr. Kettering, of course, was an engineer, and he was interested in everything that related to engineering, from surgical instruments to the big diesel standby generator over in the power plant. Mrs. Kettering also was interested in everything, more interested in decorating and color than Mr. Kettering was, but she had a part in practically every color that was used in the interior of the hospital.
A truck drove up in front of the hospital one day before the hospital opened, and Mrs. Kettering appeared at George Nelson's door, his office, and said, I would like to have a hammer and a man. And he went out to fulfill her wishes, and he came back with the hammer, and he said,
here's your man, let's hang the pictures. I didn't know where they were. We walked out to the lobby, and there was a moving van in the driveway just outside, and in that was a stack of pictures, some paintings and some fine prints, scores of them, along with some furniture for the lobbies on the several floors.
They went throughout the hospital and hung pictures.
Well, I'd hold it up. She said, no, that's too high. Put it lower. A little lower. No, another couple inches down. And when we got it where she wanted, that's where I'd hang it. We went back to the office at the end of the day, and she sat down and said, George, you're the first man I've met that knows how low a picture should be hung. I hung them where she told me to hang them.
We were invited to their home quite a few times with the faculty and with student groups, and he loved to take us all downstairs and show us his Johnny house back there.
You don't think of having an outhouse in a house like this, so you walk into this funny little outhouse in your grandparents' home, and on these walls were all these signatures. You've got Orville Wright, and you've got Thomas Edison, and it was the most amazing thing to walk down there and just stare at all these names that you're studying about in school.
Susan's grandfather, Eugene, was an accomplished engineer in his own right. His work perfecting the diesel engine for locomotives revolutionized the railroad industry and helped bring an end to steam-driven trains. His grandchildren, however, were impressed with a different kind of accomplishment.
He was fun. He had a great smile and a wonderful sense of humor, and he had one talent that I thought was pretty impressive. He could walk on his hands. And I think as a child, that was pretty impressive to have your grandfather, because when you're young, you think of your grandparents as being so old. And I know I'm probably about the same age now that he was when he was doing that, and I still can't walk on my hands. But he actually did it up the stairs here. I remember watching him go up several stairs on his hands, and was always intrigued by that fact that he could do that.
After Eugene Kettering passed away, Virginia Kettering took up the mantle, and she continuously prodded the hospital to keep expanding, not just physically, but also in the scope of services that it was providing.
She moved about with a charm that you would apply to those who were in royalty. You know, very graceful, very courteous, very kind to employees. That was her character.
I learned that behind that gentle and gracious set of expressions, there was a lot of energy and fire, which I got to experience in a couple of times. But I felt immediately a warmth and rapport that it only grew over the years.
I've often said that healthcare is where the rubber of theology, the rubber of what we believe, meets the hard road of life as people experience life.
When they would call me all hours of the day and night to come in for emergencies, I always just said a brief prayer for guidance, for calm, because that spilled over onto the people in the room.
We have an environment here where one is not ridiculed or criticized for that kind of activity. It's not required that people do that, but we have an atmosphere where people treat each other with respect.
And it doesn't matter what denomination. Christian people are Christian people. And that's why a lot of people come to Kettering to work, because they want that atmosphere. They want the comfort of that kind of family.
One of my members of the church was having open heart surgery, but that night woke up around 12:30, recognizing that his surgeon was going to be holding his heart in his hands in about 8 hours. And he did what we all do when we're lying in a hospital bed and don't know what to do. We're counting the holes in the ceiling tiles above us. And he said the door to my room opened, and a lady came in, and she was dusting the floor, tidying up quietly, and she noticed that I was lying there because I turned my head. And she said, "You're having surgery tomorrow, aren't you?" And my church member said, "Well, how do you know?" She said, "Your eyes are like this, and you're wide awake. It's like what a lot of people do." And she said, "I want you to know that this is a wonderful hospital. We pray for our patients before they come, even though we don't know their names." And my church member said, "Well, prayer is important to me." And she said, "Well, I'll pray for you tomorrow and remember you in my prayers." And he said, "Oh, thank you very much." And she said, "Well, prayer is important to you. Let me pray for you now." And she came over, Pastor, and she put her hand on my elbow, and she prayed, and it was just like an angel whispering in my ears.
If you feel comfortable praying with a patient, pray with that patient if it's appropriate. And I can tell you that when you are taking a patient to surgery, there's nothing more calming than put a hand on that patient and pray for them. When that physician is ready to do surgery, before they're putting them out with anesthesia, pray with that patient as a physician. You want to see a calming effect? Prayer works.
I've been here 44 years, and I don't want to retire because people are so wonderful to work with. So those people that are out golfing, and they go out and they praise when they hit a hole-in-one. And I tell my patients, I hit a hole-in-one every day.
Some people's heritage is part of their history. People will tell you ours is part of our culture today. Innovation was one of the big factors of the Ketterings, and it's something we're always looking at how we can be better.
Kettering Health Network has grown phenomenally, probably more than Eugene and Virginia ever imagined. And I think we as leaders are building on the shoulders of those who came before us.
I think the blending of the Kettering legacy and the Adventist community commitment to compassionate care makes it unique.
In this organization, you have as your base, your mission, your values, your vision, your people. It's all about your people. You can have great bricks and mortar. You can have great equipment. If you don't have the right people at the base, what are you going to be? Bricks and mortar? Can't do anything. It's your people.
Some of the nicest people in the world, I thought, were all concentrated here at Kettering Hospital.
I think that the Ketterings would be extremely proud of what has been accomplished at their hospital. I think they would just be overwhelmed with the advances that have been made and how we have really achieved national prominence in the areas of clinical quality. I mean, we have consistently been ranked in the top 10% of hospitals nationally, whether it's U.S. News and World Reports, whether it's top 100 hospitals, Health Grades, any of those organizations consistently rank us at the very top, and they would be very proud.
I think the foundation that Kettering was built on is strong, and I think that as long as we look to our past, it'll guide us along the way to our future. You know, just hearing the history of Charles Kettering and knowing that history, hearing my dad talk about that history, it's just really an exciting thing to be a part of.
They saw great things, and they were about creating great things. And I don't think they would ever underestimate the capacity of people with mission and commitment to accomplish great things.
People recognize that this isn't just about doing my job. This is about being and creating community, creating hope, creating that awareness of others. And this is a mission-minded place with mission-minded people, and it feels different. It's entirely different. And that's a blessing.
Come along the journey with us. See how it looks in another 10, 20 years. And you'll find that, again, changes will take place. They'll continue to do that, and we'll improve.
A vision that began long ago in the hearts and minds of the Kettering family. A vision which has become a reality and now extends through 8 medical centers and more than 120 outpatient facilities and physician offices. A vision carried on by the Kettering Health Network family to continue our mission of improving the lives of the people in the communities we serve.